little bit closer. So I've known her for about 11 years, and when I first became involved with Mila, I didn't have the guts to talk to her. But as I started talking to more doctors, and I heard any doctor who was nutritionally focused came back to me. What do you want?
Can you lift her up a little bit?
Can I lift her up?
Yeah, just just pull it forward a little bit. There you go. There. Okay, now we can see it.
Any doctor that was nutritionally focused who I took this food to came back to me in a week and said, "Do you know how good this is?" So I finally got the nerve up to take it to Dr. Worthington, and what I did was I mailed her a bag, and I called her and emailed her and finally drove to Gainesville and said, "Why aren't you taking it?" And I don't know if she remembers this or not, but she was seeing a whole lot of patients, and she said, "Well, I already recommend fish oil to all of my patients." And when I showed her what was in the Mila, she said, "Okay, I'll try it." And she signed up as a distributor about 2 months later. So Nancy, I want you to tell your story of why you like Mila, why you're recommending it to your patients, and just why you're here. We're so glad to have you on here tonight. So please just tell us why you love Mila and why you decided to be a distributor.
Well, like Rachel said, and actually thank you, Rachel, for introducing the Mila. It really is a wonderful product. I take care of a tremendous number of children who are on the autistic spectrum, ADHD, anxiety, just things that we never saw, in the early 80s, 90s, things that I was never trained to take care of. It's just a different world out there. The children have diseases that you don't expect kids to have. They are the result of chronic inflammation. And as Pam was describing earlier, all our adult diseases are the end result of chronic inflammation. Our diet is not good for us, and our food is really the instruction manual for the genes that we were given. We need to feed our children better. I was using omega-3 fish oils extensively because children need them. Their brain needs them. The car cannot run without oil. Their brain cannot function properly without omega-3s. And I focused exclusively on omega-3 fish oils. For children under 2, kind of that pre-formed DHA, one of the essential fatty acids, I still think is ideal. But until Rachel introduced me to Mila, I really did not appreciate the importance of the alpha-linolenic acid, which is the essential fatty acid that is in Mila. In fact, it is often a very underappreciated omega-3. It is the parent essential fatty acid. We can take alpha-linolenic acid and make all the other things that we need to make, all the other essential fatty acids that we make. The caveat being we also need to not feed our children lots of the omega-6 inflammatory compounds, the hydrogenated oils, the oils, the other things that are out there. But the Mila, as they've described before, it is a perfect raw food. Our children are not eating properly. And if we can get those omega-3s in, and the fiber, and the calcium, and the antioxidants, we can down-regulate the tremendous inflammation and oxidative stress their tiny little bodies are under, and they're so much healthier.
Thank you, Nancy. I remember you. I remember when I came to your office and you were recommending fish oil, and I asked you why you had gotten into nutrition, because when I worked for you, I didn't really remember you being involved or interested really into nutrition. And I remember you telling me about the increased diagnosis of autism that you were having. Can you tell us a little bit more about what you've seen happen with the children that you've been diagnosing over the last 5 to 10 years?
Well, as most people probably, you just turn on the news, there just does epidemic of autism, I feel, is real. But there's also an epidemic of children with attention difficulties, learning difficulties, reading difficulties, anxiety. So many anxious, nervous, upset, unhappy children. And it is multifactorial. But the bottom line, the base of the pyramid is the kids have got to be fed properly. As I said earlier, it really is the manual for their genes. If there's a family history of anxiety or depression or diabetes or thyroid disease, the children clearly carry that genetic potential. Whether they express it or not depends on how we take care of them and feed them and keep all those inflammatory cascades settled down. One other thing actually that was interesting that I just wanted to point out with the Mila is that it is rich in flavonoids. Very hard to get kids to eat fruits and vegetables all day long. It is very hard to get adequate amounts of flavonoids in children. One of them is quercetin, which I think we'll probably be hearing more about in the upcoming years. At a recent conference I was at, there was a lot of emphasis looking at quercetin as a very, very potent anti-inflammatory for our nervous system. And think of dementia and Alzheimer's. Autism is a neural inflammation. So quercetin is right there in the Mila.
Wow. That's fantastic. I don't think I've ever heard that before. I don't think anyone in the room has ever heard that before. So I'm going to allow anyone to ask a few questions maybe, just because we do have you on. And so does anyone have any questions for the pediatrician? Can anyone think of? Okay, I've got one from my friend Lauren.
I just wanted to ask her, I do feed it to my daughter who's just turned 1.
Yep.
And
So Lauren's saying she does feed it to her daughter who just turned 1. And are you going to ask, is there anything wrong with it?
just wanted to see, because she said she
Yep.
recommended
So she's saying, is that something she should be giving to her daughter who just turned 1?
Tell her I've been feeding it to
She's
her
been-
for 7 months.
She's been feeding it to her for the last 7 months. And Lauren also took it while she was while you were pregnant and breastfeeding.
Yeah, absolutely nothing wrong with it. You know, the baby's getting, all this wonderful nutrition. So nothing wrong with it at all.
Okay, that made her happy. Anyone else? Anybody else have any other questions? No?
What's our number one recommended way to get it into a small child?
Your number one recommended way to get it into a small child. Yeah, we
Oh,
Ketchup!
ketchup.
ketchup?
Of course, duh.
That's it. Actually, I got that. My parents are the most wonderful teachers, and I've gotten so many kids on this. And one of my moms, whose kid is autistic, and their food likes are incredibly narrow. And she mixed it up in his ketchup, and that's how he got it in. And she called the office about a week and a half after he had started on the Mila, and she was giddy. She could not stop laughing and talking and probably half crying at the same time, because he had, in her words, a 2-foot long poop, and he had started much more meaningful language and communication and sentences, and she was beside herself with the difference. So that was a good Mila testimony that we had.
That's great. I've never heard ketchup, so that's another good tip. Anybody else? Have you thought of anything else that you'd like to ask her? Kathy, one more. Dr. Worthington.
Because I'm expecting my first grandchild, so I have my daughter on Mila, who's pregnant. But what would the dosage be for smaller children?
So she's asking what the dosage would be for smaller children.
For smaller children, on like the little ones, like you kind of that 1 to 2 year range, really 1 to 1.5 teaspoons is great. And then on my older kids, I'm doing 2 to 3 teaspoons, and I'm really kind of titrating it to get a good, 1 to 2 soft bowel movements a day. We talk a lot about poops in pediatric land, and if you can get these kids pooping right, life is good.
Yeah.
Okay. Anyone else? Okay. Dr. Worthington, thank you so much. I actually would love to have you stay on just so that you can hear the next testimony or two that we're going to have. But we really, really appreciate it. So thank you very, very much.
Thank you.